My name is Heather Relation. I'm the membership concierge for the New York State Dental Association. The members of the new dentist committee have decided to put on this presentation for you tonight to ensure that your questions get answered, the questions that you're not learning in your residency program, and ones that maybe will hopefully at the end of this presentation and discussion makes you feel a little bit better prepared for the next steps in your career. Before I go into introducing our presenters, I just wanted to give you guys a little information on the New York State Dental Association. Some of you might be joining from another state, but then you will be an ADA member no matter what. So to just give you a little bit of information, and then I'll go right into giving the floor to our presenters. So I'm just going to go ahead and share my screen. Okay, so we're the New York State Dental Association, your community for a better future. It's a power of three with the American Dental Association and your local dental society. So no matter what state you're in, you will have what we call a tripartite membership, which is national, state, and local representation. That means that you have advocacy on the national, state, and local levels. This is your seat at the table. This is how you are a leader in your profession, how you ensure that that dentistry is what you want it to be. Pretty hot button topics these days are student loan reform. Obviously, fluoride is a big one. So we do a lot of advocacy on the state and national levels. We also have our own PAC. Most states have that as well, that we take collections for that, and then we use that towards our legislative advocacy efforts. And having a strength in numbers, if we represent the majority of dentists, obviously we have more clout with those legislative pushes. So you being a member is so important for that reason, no matter if you might find that you're working for an organization that gives you most of your benefits, insurance and whatnot. It's still always important to be a member of the association because this is your voice for your profession. You can lead your generation of dentists, and as a new dentist representative on a NYSDA counselor committee, and you'll be able to have a seat at the table with making any policy adjustments. This picture's from Advocacy and Day in Washington, D.C. this year. We offer discounted CE courses. We have a CE Navigator that allows you to streamline your CE submissions. It's a free application for all NYSDA members. This is exclusive to New York State. So if you're out of state, you might want to ask your state, see if they have anything along these lines, but you can download your official transcript and submit it right to your state for your license renewal. There's also events that are put on mostly by the local dental society, but you will see advocacy events. But there are things in terms of networking and, you know, maybe even finding a job on your local level. So keep an eye out for that. We offer legal resources, a legal protection plan, and a big one is employment contract analysis. We have a team of lawyers who have offered 10% discount to NYSDA members for employment contract analysis, purchasing a practice, entity creation, and really any other legal services you need. Patient complaints happen every day. We have a confidential impartial mediation and binding arbitration process. You don't have to pay any money. It's part of your benefit as a member. And these are court upheld decisions. And typically, if many monies are rewarded back to the patient, is only what they paid to you and no other damages. We offer insurance discounts for professional liability insurance. Our sponsor tonight is Milmic. They offer a new dentist $50 first year policy, and NYSDA will reimburse that for you. Just go ahead and submit that once you take that policy. ADA Protective also offers life and disability insurance. If you get it early before any pre-existing conditions, you probably will get a pretty decent insurance policy. So I encourage you to take advantage of that as well. We also have mental health and wellness resources and discounted practice support resources, including you can speak with me. I'm the membership concierge. That's my contact information. And I encourage you to scan the member benefits guide to get a little more information on what we have. And you might be wondering, how can you even get involved as a resident? Your membership is free. Everyone who signed up tonight, we already verified that your membership is active. But in case you're a little unsure, you can scan that. You can attend your local dental societies, join for advocacy days, and find a job or advertise your availability through our resources as well. I offer one-on-one member benefits overviews with me. So if you are curious at all of what you can get, go ahead and shoot me an email. I'll give you all this information following this webinar. But that's just some little testimonials as to people who have already done that with me. We offer a new dentist survival guide series. I encourage you to scan that as well. A lot of tip sheets, really important information that you'll want to take away from tonight. And always follow us on social media. We're on Facebook, LinkedIn, X, and Instagram. And again, thank you to our sponsor, Milmic. And I'm going to stop sharing my screen because I would really like to introduce our panel tonight. We have Dr. Kathie Rothas. We have Dr. Evan Conley, Dr. Morgan Fryer, Dr. Patrick Miccaroni, and Dr. Joe Solomon. They are all experts in their respective fields. Some are in public health, others are practice owners and resident attendings. So a lot of different areas of interest there. And we're going to be covering, you guys submitted a lot of questions, but a lot of them are very similar. So we wanted to kind of condense it down into topics. So we have finding and choosing a job interviews, contracts and negotiations, compensation, benefits and insurance, transitioning from residency to practice, professional growth and clinical development, licensure and credentialing, and public health research and organized dentistry. So without further ado, I want to go ahead and let our panelists kind of take over. And we can start by kind of going through what we have compiled. We can start with finding and choosing a job. And if you guys have it in front of you, go ahead and take it away.
Well, hey guys, before my colleagues go for it, I asked Heather if I could just share a little bit of insight. I know I'm not the newest dentist, but I work with a lot of newer dentists. I actually graduated with Dr. Fryer's sister in 2006 from University of Buffalo. Now, when I entered my career, things seemed great. About 18 months into practice, the Great Recession, the economic collapse happened in 2007, 2008, and it really knocked the economy and the profession and a lot of other things kind of for a loop. And I know there's a lot of things in the news right now, economic anxiety, worry about the job market and those types of things. And there's a lot of like definite negative vibes happening right now. And I wanted to say that you guys have the benefit of a little bit of foreshadowing that things could be on the horizon, but you're still insulated from it right now. And as you enter your career, there's definitely things that I wish I knew when I was about to enter the job market, maybe have like a 6-month to a 1-year heads up and stuff like that. So I'm trying to present it as a message of hope in the sense that some of the things you might hear tonight definitely are going to be some good ideas, but then a lot of it is going to require a little bit of effort and follow up on your guys' end. But for as bad as things might seem, or for some of that economic anxiety out there for people who may be entering the job market within the next, half year to a year, just have an open mind and just realize that, at the end of the day, you're a professional. You've worked hard for your degree. You've worked hard to put yourself in the position you're at, and your job skills and your knowledge base are a valuable asset. Okay. So make sure you just keep that close to your vest and stuff like that. And if you feel like you're getting anxious about hearing, we're going to go into recession and all this other negative stuff, just remember that you're a professional. People need your service. Okay. And just don't get too doom and gloom about it. Okay. Keep your eyes open, keep your options open, but take it from somebody that I wish I knew that the economy was going to get bad 18 months after I graduated. I would have made some different decisions right off the bat and stuff. So keep an open mind, but just realize, sometimes that negativity, it's a feedback loop. And if we buy into it and eat into it, then it's gonna get at us. So there's still a lot of hope out there. Okay, guys, don't be stressing too much.
Thank you, Dr. Solomon. Okay, so if everybody wants to just kind of get into the questions that we have on finding and choosing a job.
Hi, everyone. I'm Dr. Conley. I can get started. One of the first questions that we had here was where and how to find job opportunities. You know, pretty commonly, you'll hear word of mouth come up a lot. Whether you're a member of a study club, in Buffalo, we have a dental bowling league. We have your residency directors. All of them are constantly having people email them and reach out to them asking for young recommendations. And, sometimes there's even the, you know, random ones. You have to be cautious with the sources for jobs. Sometimes there'll be dental practice brokers that you might see at shows and events, and a lot of them often do know of offices that are in the process of transitions, or someone's looking to expand and will be looking for a dentist. So those are, great resources, but you always want to vet, wherever you're getting the information from. Those are more for the private practice side of things. I'm sure Dr. Salomon can talk a little bit about, public health and how to find opportunities there. So I'll, let him get to that. And I would also say, if you do, for example, you're teaching in a residency program that might be affiliated with the local dental school, ask around staff and faculty if you're in the school at all. A lot of them, have colleagues who may be looking around. So definitely, lean on those great mentors of yours because a lot of times they can help set you up for great success.
I'll chime in a little bit. I'm Dr. Kathie Rothas. I am the new dentist trustee for the state of New York. So kind of going off of what Evan said, you can also reach out. There typically is a directory on the New York State Dental Association website for the different district executive directors. So if you kind of have an idea of where you would like to end up in the state of New York, whether you want to go up to Buffalo, or you want to come down by me in the capital region, Heather and Morgan and I, or you want to go down Westchester area, or Long Island or other places, all of those component societies have executive directors, and a lot of times they have members in their societies reaching out to them being like, hey, like I'm looking to find an associate, or I'm looking to expand and looking to bring on new team members. Have you heard of anything, or do you know anybody? So they're also great resources as well. Again, same thing, if you're looking to, like, maybe you're not going to be staying in the state, maybe you're going to a different state, or you're currently in a different state. Again, looking on your state association websites for those local component executive directors, or if there's someone who's similar or an equivalent role as Heather, looking to contact those individuals and say, hey, I'm looking for, this is what I'm looking for. I'm the dental director at a community health center in the capital region. I was a scholar, so for loan repayment, and so we actually had our own kind of, the equivalent of Indeed, but through the federal government, to find jobs. But also, if you are interested in the community health sector, and exploring opportunities in community health centers, there's a couple ways that you can find job opportunities. So we also have professional organizations. So the National Network for Oral Health Access is one of our organizations where pretty much every dental director in the country is a member. There's a job board there. There's also the American Association of Public Health Dentistry has a job board as well. And then you can also, if you just kind of want to do some cold, investigation, you can go to HRSA, the Health Resource Service Administration has Find a Health Center. And you can search by state, and it'll give you every single health center in a specific state. And you can go onto their individual websites and see what their job opportunities are. Every website for a health center has a job opportunities or career button, and it will list all their open positions currently. So those are some ways you can find jobs if you're looking for a community health center opportunity.
And I agree with everything my colleague Dr. Kathie Rothas said regarding public health job opportunities. I'm in the public health sector, but more specifically, I work through Indian Health Services. And IHS, represents all of the federal, tribal, and urban health center programs set up for Native Americans throughout the United States. There's 322 programs across the country. The vast majority of them are tribal run and operated clinics. A fair amount of them are federal, and some of the other ones are urban, that are located in urban centers, so not on Native American territories. What I did want to add was another job locator would be usa.gov/jobs or IHS, indianhealthservices.gov/jobs. So those have more government specific ones, but there is some crossover to what Katie was saying, that some of those same ones that are on the NHSC's locator and I always mess up the acronym. Say it again. NNOA.
NOAA or
Yeah,
APHD.
right. So I'm in public health, but I'm more on the tribal side of things, where I work for a government agency through a tribal government. So with also public health was also with public service as well too. So if I could just mention that, but I think, yeah, those are definitely great resources. Absolutely.
Hey guys, I'll also chime in as well. I'm Dr. Patrick McCaroni. Hello, and I just first wanted to say congratulations to all you residents. I feel like you're in a great field. I feel like you're going to be successful no matter which path you take. And I think just the important thing is being honest with what your needs and wants are and trying to pursue it. And you're going to be fantastic. That being said, I'm a pediatric dentist and a small practice owner. I own a practice with a few associates. I graduated in 2019, but I also help with the 5th District Dental Society, which for those of you who might not know, it's Syracuse, Utica area. And for example, for new dentists and local residents, we offer what we call a dental speed dating, where local dentists who are wanting to take on an associate, for example, or sell their practice or what have you, will kind of sign up for this event and meet up. And I think that a lot of other areas in New York and a lot of other districts have similar kind of situations. So I would just recommend, if you have an area located, especially in New York, but anywhere that you feel like you might want to practice, check in with the local district. And I feel like they'll have a wealth of resources for you, wherever it may be. I just think it's a really, really important thing. I think that there's so many opportunities and so many people that are just, especially a lot of older dentists who are looking to take on associate retire. They're begging and wanting to have somebody come with them. They just might not know how to do it other than through their local district. So check in with them. I'd highly recommend it. And I look forward to talking more.
Morgan, did you want to move on to the corporate offices versus private office topic?
Yeah, definitely. So the question was deciding between corporate, private offices. So like Dr. Solomon had said, I work in private practice. I work with my sister, who is also a dentist. But when I was just getting started and trying to piece, all my work days together, I worked for a gentleman just one day a week. He, similar to like Dr. McCaroni is saying, was ready to retire. He just wanted to go out and golf one day a week. So I was there for a while, but when he was not able to sell his practice, he ended up selling to a corporation. And I actually had to pay to leave there. I was only there the one day, so I'd walk in each morning, have no idea what my schedule was going to be. I couldn't remote in. I had no control over it. So ultimately, I wasn't able to hit their production goals, and I was literally paying to work there. So long story short, I paid my debt off to them and left. But they were changing the materials we could use. They were changing the labs that we were able to send to, and it just wasn't in line with my values. So that's just my experience. I witnessed them make really big promises, and really the employees and the patients were just a number to them. So ultimately, all the employees left. They couldn't keep a dentist, and the practice closed down. So something to look out for. I think in the beginning, it's really tempting to sign on to some of these places that offer like big bonuses or whatever it may be, but just keep an eye open for situations like that.
Yeah. And I think
I would say that Heather is a great resource to go over. She talked about how NYSDA will offer that reduced contract negotiation, stuff like that. That's the important time to make sure that you understand what you're signing up for exactly. And Heather, if you reach out to her, she can put you in touch with a lawyer that can really make sure that, you know, you're in a good situation. I think it's pretty important. So she offers a lot, which we're so happy that she's helping do this webinar to oversee it and make sure that you guys know the resources so that you can hopefully avoid that kind of situation.
Yeah. And also know that, you know, not every corporation is the same. And sometimes even offices within the same like corporate ownership are different based on who like the lead dentist is for that, you know, the office. So really you kind of do your research. You know, there's a lot of places out there. We even have some that are, you know, there's big like national places like Pacific and Heartland and Aspen. There's also smaller you know, DSOs or corporate offices. Like we have one in our area called Brookbeam. That's you know, a lot of dentists. It's almost like its own little community because they're all within the same geographic region. But they also do like internal CE and other things. And then there's also, you know, there's a place called that's been up and coming called I think it's Tend, and that one's focused in urban centers. That actually their chief dental officer for that organization went to Stony Brook. Dr. Salerno, if you ever were at an ASDA event at the National Leadership Conference, he's the chief dental officer. So again, there's a lot of different sizes. There's a lot of different styles. You know, so, you know, really kind of do your research if that's something that you're considering to make sure that it's the right environment for you. And like, you're going to feel that, you know, you're going to be supported and not be, you know, pressured to do things at a pace that you're not comfortable with. So, all right, let's see. And then it looks like our next one, what to focus on during your job search. Who wants to start off with that one? Anybody? No? I could just throw in a few things and people can go in there. So I would say really do some self-reflection. You know, do you know where you want to live? Do you like, it doesn't even have to be a specific location. Maybe it's just like, I want to be in an urban environment. Like for me, I love nature, but I don't want to like live and practice in the middle of nowhere in this, what I would consider the sticks. But some people may really want to be in that kind of a setting. So I think picking out like, where do you want to end up? What kind of setting do you want to be in is the first step. But then also, you know, looking at, you know, what are you looking for in your practice of dentistry? You know, do you want all the latest, greatest, you know, gizmos and gadgets right off the bat? Do you want to have, you know, opportunity for growth? Do you want to be in an office where you're, you know, maybe you're a satellite location and you're kind of by yourself and would have to call somebody if you got into trouble? Or do you want to have an opportunity to have some mentorship? You know, I think those are all, you know, important things. Or, you know, even kind of like how many, you know, are there patient volumes? You know, productivity goals, those are things you want to look at. You know, so I think those are some things to kind of start considering your job search. How big or how small do you want the practice to be? You know, how much support do you want available to you? And then also like, where do you see yourself living in the short or long term? So anybody else have some other thoughts on that?
I think all excellent points. And one thing I'd like to add with what Katie said, on my perspective, all of those things that she was talking about were questions that I was continually asking myself. In my first 3 years of private practice, I worked at no less than 7 different offices. Okay, so I'm pointing that out because you're not just going to ask the questions that Katie was just saying between now and July. You're going to be asking yourself those questions multiple times over the next several years as you're at different offices or after you take your first job, because the reality of the situation is nobody stays at the same job that long at one of their initial jobs. I thought I was going to be in Hawaii my entire career. I thought it would be great, but the economy collapsed and I was working 6.5 days a week and I could barely support my family. And we moved back and I took a position within the Indian Health Services structure, so I could have guaranteed salary and benefits, moving back home, especially during a time of, economic uncertainty and stuff. I'm not saying that because it's a bad thing, but what I am saying is at every office I was at, I was like, do I really like this area? This patient volume is ridiculous. I'm getting ripped off. All these other questions and stuff. So those aren't, what Katie was telling you guys, aren't just questions to think about for the next 6 months. You're going to be thinking about them throughout your entire span as a new dentist and stuff. But just, have that critical mindset to just be asking yourself those questions. And just, I feel like questions you should know when you're job searching. I feel like to some extent as new dentists, when I was a new dentist, I was always job searching. If I wasn't in searching for a new job, I was asking those questions about my job, how I could make this better, or is it time to, is this really what I want for my career and stuff? So yeah, good questions, but you're going to be asking yourself those things multiple times, definitely.
I can jump in on that as well, and it'll kind of tie into our next question as well. When you're focusing on the job search, not only do you want to think about your setting, the culture and goals, but overall, where do you see yourself long term? Are you looking for to be an associate, for the duration of your career? Do you have zero interest in, taking on a partnership or ownership, or, are you looking more for mentorship and, a strong basis and emphasis on CE? Those are all different things that practices can have to offer you. And if you have an opportunity that, you feel like is something that, you want to jump into, that's a great opportunity to reach out to Heather or, get in touch with one of the attorneys that NYSDA has, or, just to kind of go over what the logistics would be, especially if you're offered, like a partnership or an opportunity to purchase into a practice, because there's a lot of variables that come along with that. And it can seem intimidating and overwhelming. And I think that's a big barrier for us younger dentists. But people are making that jump as well. If you feel like you're well equipped or set up to take on more of that role, don't feel limited by your age or, number of years of practice, because definitely there are people, going into every different facet of dentistry and every type of job role at various ages and status of their career. So definitely, try to fit in your long-term goals into what your next opportunity is as well.
Awesome. All right. Heather, did you want, sorry, Heather. Morgan, did you want to jump into, advice about handling multiple part-time gigs?
Definitely. Yeah. So I actually really like the thought of having multiple part-time gigs. I have 3 kids right now, but before I had kids, I was working 6 days a week or so, and I split it amongst a few different places. I was doing 3 days at my current office, and then that one day with the gentleman who was near retirement. And then I would do usually 2 days a week at a local dental hygiene school. And I really enjoyed the variety. I felt like I never spent too much time in one place. I was working with different coworkers, seeing different patients. And the hygiene school was a completely different pace and setting than private practice. So I think that helped me not to get burned out in the beginning by just being clinical 5 days a week or whatever people decide to do to begin with. The hygiene school, and I'm sure any school in general, also gave me an opportunity to get to know graduating hygienists that were looking for jobs. We've brought some of them into our office and helped others find jobs locally. So I definitely like the thought of having multiple gigs going. I get some people just like to be in one place at a time, and that's basically where I am now. Having kids, being at all of those different spots is just too much. But I would definitely keep that in mind when you're starting. I do think it's pretty common to do in some of the cities and wherever, but I've got friends in New York, for example, in the city, and I know that they piece their week together through at least 2 or 3 jobs. So I'm a big fan.
Yeah. I've definitely have friends who have done multiple, part-time jobs in Colorado, in Georgia, in other places. It was also a way for people to kind of be able to compare different offices, because like if you are only in one space, you only know what you know, and you don't know like if this is like the hottest thing since white bread, or you're like, oh wow, like this is actually kind of like not a good environment, or like this is actually toxic compared to another office. So it's definitely nice to kind of have that ability to get a taste of different offices or different ways people run their offices, structure their offices, do their scheduling, to kind of find out like what you like or don't like. I know other people too who've done part-time in a community health center because you can get loan repayment, and then they also will do part-time at a private office that they then see themselves perhaps at one point becoming a partner or an owner of. I know somebody who did that. He actually did full-time in a health center, and then he did part-time at the private office, and then at a certain point when he paid off his loans, or he got his public service loan forgiveness qualification, he then switched his hours because he actually still really enjoyed and valued the work he was doing at the community health center. So he just became full-time at the office he ultimately bought and owned, but then continued like 1 day a week or 2 days a week, or doing like, working vacations at the community health center to kind of keep his connection to them in the community. So lots of different routes you can do. Morgan, would you say there's anything you have to look out for as far as contracts if you're going to have multiple part-time positions?
Well, definitely, because I thought, oh, I'm only with this one guy 1 day a week. It's not going to be that big of a deal. And that was the office that I ended up going into and having to pay to leave when things changed. So no matter how small or how big the opportunity is, definitely read over everything, read over it with a lawyer, and don't make that same mistake that I made.
All right. Anybody else? Any other comments about doing multiple part-times? No? All righty. All right. Evan, you want to talk about considering doing a fellowship or a second year residency?
Yeah. As part of my background, I did do a chief year of residency in a GPR program in Buffalo. And it was something that when I started the program, I never thought that I would do, nor did I anticipate doing. However, a main reason is it fit my timeline. During my residency, I had an opportunity come up to take over and purchase a dental office. And after a long process that felt like, basically going on dates with the owner and trying to just figure out, would this work? Does the culture match up? And how can I make this work, as a very new dentist? And we structured the way things were set up that I was going to have a year essentially to figure out what I wanted to do before that opportunity would be, available to me. And I had toyed around with different job offers, and I am so happy and thankful that I did do a second year of residency. Just the amount of mentorship and growth that I even saw during that time. It's definitely something to consider for anyone if the opportunity works out. I feel like any income that I forego or, didn't get during that time has more than paid for itself in the additional education and training. I can't even imagine how much I would spend on CE to have had the same amount of clinical and case experience that I gained through that. And that's different for everyone. You have to make sure that it's with a program or a team that you really feel like you can learn from and grow with. And ultimately, that's part of how I became an attending at that residency program. Most residencies have a requirement where you need more than a year of residency experience to become an attending. The program that I'm at, it's a requirement. All the attendings there had to have done 2 years of a residency before they're even considered to be hired. So that was, it opened up another door for me that I also didn't foresee myself entering. And, I'm also super grateful that I did. And you don't have to do a second year at the program that you did your first year at. There are programs that you can, if there is a second year option, there are programs that do accept residents from one. It's very common downstate where we see people bounce from one program to the other because some programs have implant fellowships then where you can do a chief year and then go into an implant fellowship. And all of those are available to you and often not really discussed.
Awesome. And I will,
Evan,
I'll
sorry.
go ahead. Go ahead, Joe.
No, I wanted to ask Evan. Evan, would you say that there's also some benefit in your second year, also teaching and working with the first year residents, like you're learning by also imparting some of the knowledge that you have by teaching your colleagues? I just wanted to see if you agree with that.
Absolutely. And our program is nice because during your chief year, you actually are a resident 4 days a week. You'll have your state license and you moonlight 1 day a week or 2 if you want to work a weekend day as well. So, they want you to have that private practice experience, but also teaching your underclassmen and then taking on whatever cases you find most interesting, appealing, or challenging.
Awesome. I'll chime in a little bit too, because I also did a second year of residency. Mine was a bit, I guess more, I don't know, unconventional, but I did the New York Medical College GPR program, and I did it at their Westchester Medical Center site, as well as their Open Door Family Medical Center site, which was an FQHC. And it was a level 1 trauma hospital my first year, and then a federally qualified health center the second year. And I did that in part also because at the time they had a HRSA grant to fund a master's in public health. So I was taking my MPH courses as well as functioning as a resident. And so my first year at the level 1 trauma center, we took call, we were on call every 3 days, but every 3 weeks we were on trauma call. We also had an oral surgery program, so we would take first call for oral surgery. So I did a lot of crazy cases like chainsaw to the face, stab to the face, like a lot of cool facial trauma cases, or kid fell down the stairs, he had to splint a lot of teeth, like all kinds of cool stuff like that. And we also did special needs patient dentistry in the operating room during that year. And I really enjoyed that. But then I also in my second year in being in a community health center setting was more just kind of preparation for general dentistry and general practice. So, in those 2 different years, in those 2 different settings, so maybe if you do like a year in one place and a year in another, I got different skills. Like my first year, I feel very confident in doing, treating patients who are medically complex, and not being kind of intimidated by it. I know what to do. I know how to collaborate with medical care teams to do that safely. And then the second year, just got more comfortable with general dental procedures and pacing and things like that. So, I think it depends on, deciding on what you want to do. Is if you want to do a second year, is like, what are those programs offering? And is it something that you're interested in? I know some programs also do a second year that's more focused in oral surgery. Sometimes people will do that if they feel like they still couldn't get into an oral surgery program, or they just want to have those extra skills to be able to do some of those impacted third molar cases in their private offices and stuff like that. So really, think it really, again, depends on what are you looking for? What skills are you hoping to increase or improve on? And does a program offer that? Also, keep in mind, a lot of people I know are intimidated by the loans. If you do an income-driven repayment plan, through the federal loans. They will then base your monthly payments based on what you are currently making. So if you are making $65,000 as a resident, your monthly payment will be $300 versus the thousands of dollars that someone is expected to pay if they are in private practice and making over $100,000 a year. So, and that still counts towards, your monthly payments, towards like, your 15 years or whatever kind of payment, repayment plan that you're on. So I think that's a big misnomer that people aren't aware of, that they just think that they're either going to just put their loans in forbearance while they're in residency and let that interest continue to accumulate on it. Or they think that like, oh, I definitely can't afford to make a monthly payment on loans while I'm in residency. But if you go the income driven repayment route, you don't have to worry about that. Like I was lucky. I was in residency during COVID. And so my monthly payment is actually still locked in at my resident salary. Like they keep delaying having to recertify. So I'm still only paying $335 a month on my loans, and it's counting towards public service loan forgiveness. And it's counting towards like, all those, total payments till you're done repaying your loans. So just some things to keep in mind when you're considering what to do next. All right, what do we got next here? Okay, moving on to this section on job interviews, contracts, and negotiations. All right, Patrick, smart questions to ask during interviews or office visits.
Okay, so yeah, I felt pretty comfortable talking about some of this stuff. It says, what should I ask or expect during job interviews and reviewing contracts? And then smart questions to ask during interviews. And one thing that I think is just super important is, especially, if you're doing it at a corporate office, it might be a little bit different, but if it's more of the personal connection, you're considering working with someone who's been in private practice or a smaller group or something like that. My most big thing I always harp on with all of the residents that I get to oversee is being honest exactly with what you want. I want to be here for 1 year. I don't know if I'm going to be here 2 or 3 after that. I know for 1 year, and that's my plan for right now. Or I want to be here 5 to 10 years. I want to sit down and grow my family. Those are two very different things. And also saying, I have zero interest in being a practice owner, or I definitely need and want to be a practice owner within 1 to 2 years. And what you want to do is, it's almost like in a relationship, you both want to be super honest with what you want. And if it doesn't fit, that's okay. There's so many different options out there. And so be 100% honest with what you want. Expect that whoever you're talking to, negotiating or looking for jobs, will do the same for you. Because if they're looking for someone that's going to take over the practice in 5 years and you might be gone in a year, that's not going to work for you guys. So the biggest thing I can say is be super, super honest with what you want. It's okay if it changes, but be honest with what you want up front and expect the same and transparency from who you're talking to. And that would be, my biggest one. What are your shared goals? Do your long and short-term goals somewhat line up? And if so, starting on that foot of honesty, the rest I think really will almost take care of itself, providing you, dig their culture and all that kinds of stuff. So I don't know if anyone has anything else to add, but I was very honest with the guy that I purchased my practice from. I said, I'll be an associate for a year, but after that, I want to own the practice. And he said, well, what do you think about, becoming a partner right away? And I said, no, I kind of want to make the decisions. I want to own the practice after a year. And if that's not what you want, that's okay. And so he ended up, really enjoying it that way too. And we agreed on it and all that stuff. So that's all I have for that.
Anybody else have anything they want to chime in on that? No? Okay. I'd also, in those kinds of questions and asking people, I would ask if you visit an office, ask staff how long they've been there. If they've all been there less than, 2 years, and it's not a new practice, like it's an established practice, for me, that's a red flag. That is, that's kind of asking what's your turnover rate without asking what's your turnover rate. Because someone might not know, or they might, kind of, dance around the question. But if you ask staff, like, oh, how long have you been here? How do you like working here? I think you tend to get a fairly, honest answer from people. or they don't realize, you know, what or why you're asking. Also kind of seeing, you know, where they see the practice, you know, going in the next couple of years, and seeing if that aligns. You know, what do you guys do? I mean, Morgan's staff, like, I'm always jealous of them. Like, they're always doing fun activities together, and stuff like that. Like, they do different, like, they make vision boards, and they go on trips together, and they do CE together. So like, that's something you're looking for, like, ask about that kind of stuff. Like, do your staff members like actually enjoy each other's company, or like, what do you do as to bring camaraderie, or culture to your office? I think is an important question, because you're going to be spending a lot of time with these people. So if it feels like, you know, high school drama, then like, I certainly don't want to be in that kind of a toxic environment. So those are, I would say, some things to look out for. Guys, any like red flag things to looking out for in contracts?
Yeah. I was going to just chime in and say also that I think it's a huge red flag if you have a discussion with whoever is recruiting you for a job offer. If what they tell you doesn't match when the contract comes out, is an absolute huge red flag, I believe. Because it's definitely, if there's like any kind of difference in what you talked about and versus what is being seen in a contract, then I think that that's a huge red flag. And I have a number of my, you know, co-residents where that ended up being the case, that what they were presented in a contract was wildly different from what they were kind of told was going to be the case. And so once again, you know, get the lawyers and make sure that they're helping you understand exactly what's in the contract. And I think that's a huge red flag for sure.
Yeah. I also would say look out for, like, if you want to leave, how much notice do you have to give? Like at my clinic, you have to give 90 days. And if you give less, then you sacrifice, you know, you won't get paid out any of your PTO, and you sacrifice a couple of other things that you otherwise would receive. Also, you know, those non-competes, as far as like, what is that range in which if you leave the practice, there's a certain radius of, from that practice of where you can't go, or you can't, you know, you can join like a practice down the street, based on the way that contract. I can't remember what that terminology is. Does someone remember what that? It's like a
non-compete.
I think it's a non-compete. Yeah. So you know,
restrictive covenant.
There you go. Restrictive covenant. There you go. Yeah.
Which a lot of times when they are challenged in court, get overruled and stuff, because they violate fair trade laws and stuff like that. But I'm not saying like definitely try to like breach a contract thing or something like that. But you know, but that is the terminology that you're talking about, Katie. Yeah.
Typical contract lengths, at least like in my health center, it's 2 years. And that's renewed. Then it's renewed and reviewed every 2 years. But that's different everywhere. Sometimes some are 1 year, some are longer. All right, I think we touched about like, what do you look for when you're visiting an office? Also, look at how clean it is. You know, or, you know, ask them about like, how often do you test your water lines? And if they look at you like a deer in the headlights, run away. Because there's certain kinds of, while, you know, private offices aren't as, you know, restrictive, or like they're not overseen by like government agencies, or like my health center, like we get reviewed by the Joint Commission every several years on our like infection control policies. So while you don't necessarily have that in private practice, like they're still expected to meet infection control standards. So if you're visiting an office, I would definitely kind of take a look at that, or ask them like, walk me through like, what is your process for like cleaning and deep cleaning the office, and how often are you doing that? You know, what happens if you find that like your, you know, autoclave bags aren't sterilizing properly? Like, how do you know which ones were, you know, impacted? How often are you spore testing? Those are all kinds of things that, you know, I think are important as far as patient safety goes, and, you know, just how much attention to detail a practice owner has for their practice.
And there's also a good chance that practice owner might not have that answer. You might be best off asking that practice owner, which staff member is like your lead on infection control or quality assurance or that type of stuff, you know, and then get in their ear a little bit and ask them some of those questions about those timeliness and, you know, which criteria and policy. Because honestly, like, I don't know personally for our clinic, because I have a lead program manager and a lead dental assistant that handles a fair amount of that. And everyone rotates duties on a monthly basis, making sure that certain Indian Health Services and CDC guidelines are being met. And then we kind of like self-evaluate and self-audit each other once a month and make sure that, you know, whoever's in charge of infection control for that month, you know, is just taking a look at and documenting any areas where we see some discrepancies. On my end, as the director of the program, I really don't know who it is at any given time, but I know that if someone had a question, I could refer them to that person. So just ask if the owner's not directly hands-on with it, just ask who does this at your office.
Awesome. All right. Now, I know we only have like 8 minutes left technically, correct, Heather?
Yes, but we can continue on if everybody, I mean, we've got still plenty of topics to cover. So I guess I will just ask everybody who's attending here, just give us a thumbs up, raise your hand any way you want to let us know that you want to keep going on, because we have still compensation and benefits, transitioning from residency to practice, professional growth and clinical development, licensing, big topic, and more information on public health and research, organized dentistry.
All right. Yeah. Also, Heather, is this being recorded?
It is being recorded, and I did have you know, some resident directors telling me that some groups are not able to make it tonight, so we are going to put this on our YouTube and we'll be sharing it out as well. So we obviously don't want to keep you guys up too late. You guys have a lot going on. So if you're ready to press on, please go ahead or stay on with us as long as you can. If we start to see, you know, everybody kind of dropping off, we'll wrap it up. But we do have really great topics, and it's all what you guys have sent in for questions. So you probably, if you submitted a question, somebody else probably has the same question too.
Awesome. All right. Well, we'll keep going as rapid fire as we can here. So moving on to compensation, benefits, and insurance. So what is a fair compensation package for a new associate, and what benefits should I expect? Patrick,
Okay, I'll take this one away. Yeah. I've been in a unique position and in the sense that I've been an associate, and then also I've had the opportunity to hire now 3 associates. And so I kind of have a good idea about what I think is fair, and I can give you my perspective. Might be a little bit different in pediatric dentistry, but I think the nuts and bolts stay similar. What I recommend for a new resident coming out, if you're going into private practice, this isn't of course public health service or anything like that, but going in private practice, I like to see residents asking for a guaranteed daily minimum and a percentage of production. And it can be adjusted production, but some percentage of the production. And the reason I like that is because you want to be guaranteed that you can pay off your loans. If you're joining a practice that, say, for example, you know, is a little bit slower starting off for you, you want to have a daily assurance that you're going to be making a certain amount of money. So you have that guarantee that you can pay for your living expenses and your loans and have peace of mind about that. But on the plus side, if you end up really producing a lot quickly, then you also want to be compensated for how much you're producing as well. And I think a percentage of production is fair. I see a lot of contracts that are talking about percentage of collections. And to me, that's kind of a little bit of a red flag, because I think if you're in a well-functioning office, then your collections are going to be super high anyway. So if they're insisting, you know, if they're, you know, a really, really high functioning office, they're going to have a very, very high collection rate, close to 99% or better. So from my perspective, if you're asking for a percent of production and that's a problem for them, that's a pretty big red flag, because it's really not your job as a resident and a new dentist to collect the money. That's the practice's job. So it's not your fault if you produce and they're not, you know, collecting that money. You should still be paid, in my humble opinion, for your production. So I like to see a guaranteed daily base and a percent of production. And that number is going to vary depending on where you live, what the cost of living is, how big or small the practice is, and what kind of area you're practicing, whether it's fee for service, whether there's Medicaid in there. So there's going to be a whole lot of factors, but I think that that's a really, really good idea. And then just jumping down, I know there was another question about you know, also other benefits such as health and disability, malpractice, and paid time off and professional dues. Every practice is going to be different, but you want to look at them critically on what they're offering you. For example, I offer my associates the daily percentage, the daily minimum and a percentage of production. I also offer them health insurance because I know when I started off as an associate, I had to pay for half of my health insurance, and it sucked. It was super expensive, and it was coming off right off of residency, and I felt like it was just like, man, one more thing I have to pay for. Same thing with professional dues. You know, it can be quite expensive after the first few years of paying, and so is that something that your practice is willing to do? Isn't paid time off super important to you? You know, do you want 2 weeks paid vacation? You know, are those things that the practice is willing to negotiate? And so that everyone has a different answer on that, but definitely critically thinking about how much that is. Find out how much health insurance costs. It's pretty darn expensive if you actually look at it. And so then if that's something they can throw into that package, that's a huge pay bump for you, that kind of thing. So I'll leave it to anyone else too.
Yeah. Pat, you're essentially talking about something that's like almost like anywhere from a $15,000 to $18,000 benefit, you know, and expense when you're talking about the health insurance. But I wanted to take you back to just one thing you were saying about the difference between collection and production. You know, as an associate, guys, when you're joining an office, like you have no say in the collection practices or policies of that office. Like you're not in charge of their billing department. And if they're only collecting like 75% of what you've produced, that's not a reflection of you. You're not on the phone mailing them statements and stuff like that. Okay. So I think it's very clear that you need to be very clear that, you know, either if it is somewhat based on collection, that there's a set percentage and it's not floating based on, well, this person didn't pay their bill. Well, it's like, well, I still did the work and they were in my chair for 2 hours. I couldn't have done anything else to produce during those 2 hours and stuff like that. So I'm not going to, you know, I was in practice for 3 years and at multiple jobs that came up quite often. Or your production statement, Pat, maybe you can opine on this better, but you know, your production statement, you did a 3-surface resin for $200, but the contract with the insurance company that practice agrees to, they're only going to take $120. So you're getting your percentage based on $120 filling versus your percentage based on a $200 filling. And you have no control on that because you didn't sign on with that insurance company. That's just what the house has negotiated. So it's definitely important that you're asking those questions. Am I getting my production based on the house production, or am I getting my production based on the negotiated rate with that insurance company? So they're just good questions to ask. There's no right or wrong answer, but you just have to have your ears up and be looking for those details and stuff. So I'll leave it at that, but go ahead, Pat. I was interrupting.
All
No,
right.
I'm done. I couldn't have said it better myself. Thank you.
Amazing. I'll chime in a little bit about benefits and things that we offer at our health centers. And again, every health center is different, just like every private practice is different. So you do have to look at those contracts and ask those questions. But at least at our health center at Whitney Young Health in Albany, typically new grads make somewhere between like $110,000 and $120,000. That's a guaranteed salary. You're 5 days a week, 8 to 5. And whether you see 5 patients or 20, you get the same, you're a salaried employee. We get paid vacation. We get all of our like state licenses paid for, our DEA licenses paid for. Basic life support training is offered through our health center. You don't have to take any days off. You don't have to pay for it. Malpractice is covered because we're covered under the Federal Tort Claims Act. So you don't have to pay a malpractice. We get disability and life insurance. I get a 401k plan with a 4% match. We also get CME days separate from our PTO days. We also get CME funds every year, so about $1,500. So if I wanted to use that to go to a conference, if I wanted to do that to do a bunch of different one-day webinars or one-day hands-on courses, I can use it pretty much however I want to use that as it relates to continuing education, and that renews every single year. We get medical, dental, and vision covered. Our plan's a high deductible plan, but my health center covers $4,600 of the $5,000. So I really only pay $400 if I were to be like hospitalized or something. And then insurance in my health center picks up the rest. Same thing, they cover co-pays and other things like that. And And then at our health center, I was a National Health Service course students service loan recipient. So I got $120,000 for a 3-year commitment. That was tax-free and separate from my salary. That money was specifically just to pay on my loans. And then I also qualify for public service loan forgiveness. So I make 120 qualifying payments and work in public service for 10 years. It's about 10 years. And whatever's left over in the bucket is forgiven tax-free. That's a big thing you have to pay attention to, because if you just do one of those long-term, like 15-year paying back plans, whatever's left over, you have to pay the taxes on it. So that means like you might be dropping like a $15,000 tax check at the end of it. So those are just things to be aware of. So that's one of the things that I love to talk about with community health service, with Indian Health Service. If you look at the salary by itself, it might look lower than what you might be making in private practice. But when you add up all the things I'm not paying for and is not coming out of my paycheck, we are either at the same rate or money ahead. So that's what I'll say about.
And Katie and I have had this conversation several times, and one thing that she's hinting at is what's called your fringe benefit factor, or your fringe compensation. And I calculated it once for all the benefits that, a fair amount of the benefits Katie was talking about are the same things we offer through Indian Health Services. I do stand here as someone who has had all of the remaining debt forgiven under PSLF. So my, $430,000 of dental school debt, along with $60,000 of undergrad debt, I had been making qualified payments on through the National Health Service Corps Loan Repayment Program, where every year of service at my tribal location, I receive $30,000 tax-free. I just make a big lump payment onto my student loans once a year, wipe my hands, and then do it again the next year, After a certain amount of time, I think I had about another $190,000 forgiven, just completely discharged and stuff in May of 23. So that was definitely big to be debt free and have that out of the way. But that said, that's a benefit that isn't necessarily showing up on your W-2. It's not like if someone were to give me $30,000 to put on my student loans, and I was trying to earn that in the private sector, I would have to earn about $47,000 to have $30,000 after taxes and stuff like that. So it's just something to consider, that if you're planning on using a fair amount of your private earnings towards making loan repayments and stuff like that, you have to consider a benefit could be that while the salary is going to be a little bit lower, I'm also going to get another $30,000 that I'm not going to be paying tax on. So that's something to consider. Because I know that I'm not disciplined enough that if you gave me $30,000 and said, go pay this on your student loans, I don't think I'd do the whole thing. I know for a fact that I'm not disciplined enough, but if I'm legally required to, I know that I will. But when Katie was talking about salary being a little bit lower than benefits, I calculated this one time when I was doing my budget and stuff like that. But if the salary is X, the salary plus the benefits ends up being like X times 1.4. So it's almost as if just for a given number, if I were to say $100,000, someone might receive $100,000 as an annual salary, but they're receiving about $141,000 in benefits. So if you extrapolated that to like a wage of like $150,000, you're probably getting closer to $190,000 to close to $200,000 of benefits. Like Katie was saying, health insurance is going to be 18 grand. Money towards your student loans is going to be $300,000. Having your continuing education taken care of is, anywhere from, some contracts will be $2,500 to $5,000 in education. Your malpractice and your DEA being covered for you, that can be upwards of anywhere from $2,000 to $3,000 additional dollars. So those all are called fringe benefits. So fringe benefits are part of an overall compensation package that doesn't show up on your pay stub, okay? But you're getting it as a benefit. If you weren't getting it as a benefit, you would be paying for it on your own. So it's a question to ask when you're talking about wages at like an FQHC that Katie's talking about, or at a Indian Health Services or a tribal or a government job like I'm talking about. So figuring out what the overall compensation is as it relates to salary, and asking people, well, describe for me what the fringe percentage is, or what these fringe benefits are, and could you monetize it? Could you tell me about how much of a benefit am I getting financially at this salary level, but I'm also getting these benefits here, and added together, they do seem somewhat comparable with what my colleagues might be getting.
And I would say in private practice, you should fight for those fringe benefits as well, if you can, because I think that might be something that you can kind of, slip in there that really will make a huge difference as far as what's coming out of your pocket in general. And I would just say, just another kind of like, just a word of advice for young docs coming out there, that especially for the first 5 years out of residency, I think it's really important, no matter what you do, to kind of live at or beneath your means. I found that a lot of my colleagues that were fairly smart with their money are really not, and I graduated in 2019 from residency, so I'm not too far out, but I really don't have the financial concerns that I thought I would at this point, because I believe, I was pretty smart with just not living above my means. I didn't go out and buy a new car right away, and I didn't buy the nicest, fanciest house right away. And, I have another kid on the way, but I would just say that in general, just to throw it out there, plan to live beneath your means for, about 5 years. It's called the white coat investor kind of mantra. And I feel that, as long as you're smart with picking your contracts and things like that, that you're going to end out okay. Because I know the loan thing is so stressful, and trying to fight for those fringe benefits. I remember coming out of residency, I was like, I can't believe, I didn't ask them to pay for, whatever this dues was, or my license, or my DEA. That's $900, but $900 paying for your, $895 or whatever it is, coming out of your pocket when you're just coming out of residency is a huge amount of money. So if they can even cover that the first year or two out, that's going to make a huge difference for you. So I love that fringe benefits, Joe. That was awesome.
Amazing. Evan, do you get any benefits by being like on faculty at the residency?
Yep. I do get licensure, stipends, CE stipends, CE time off. And if I increased my hours slightly, I could then qualify for public service forgiveness because it is at a hospital facility. There's also other different, you can get health benefits, if you meet certain time requirements for the amount of time that you're committing, even in teaching roles. And I think, that depends program to program too. But also I know like some of the dental schools, being like SUNY Buffalo, there's different opportunities there for loan forgiveness and health insurance and other benefits. So those are things to keep in mind as well for those who want to get involved in teaching in any capacity.
Yeah, even if you don't want to do it long term and just be like a bench lab or sim lab instructor for the first couple of years as one of your part-time gigs, if you meet that certain threshold of hours, I think that's a great way. If you're not getting those kinds of benefits in your clinical practice job, that's another kind of hack, or if you will, or a different way to go about getting those fringe benefits and not having to pay for them out of pocket. So thanks for that. All right, I think we exhausted that area.
So Katie, just in the interest of time, because I've noticed we have a couple attendees drop off, we've just kind of discussed, maybe we can pick up the rest of it maybe in another webinar next month and turn it into a two-parter.
Sure.
That way we give everybody a fresh set of eyes, everybody can get some rest tonight, and we have so much more to go over. Just the topics, so everybody who's still on knows it's going to be transitioning from residency to practice, professional growth and clinical development, licensing and credentialing, big one, and Katie has some slides to share on that, and public health research and organized dentistry. So I'll send out a webinar once we figure out what day that'll work. I'll send out information to everybody who came on tonight and everybody who registered anyway to let you know that we're going to have that. Of course, like I said, these are being recorded, so we'll put them on our YouTube. We'll kind of edit them a little bit. Maybe we can break them up into topics so they're easier to digest. But thank you all so much for joining us tonight. I hope we answered your questions. Next time, hopefully we'll have enough time to even like get a little Q&A in there and get a little more interaction. But feel free to shoot me any messages. Again, concierge@nysdental.org is a good way to reach me. Thank you all for your participation tonight. You guys were a great audience, and we appreciate your time.
Yeah, and I'll make sure we'll send out those licensure slides now, because I think a lot of it are things you should start doing right now. So we'll make sure that those get out, but we'll go over them verbally at our next lecture, our next webinar. So thanks, everybody. This was great,
Yes.
and we look forward to the next one.
Nice
Bye,
working
everyone.
with you guys tonight.
Bye.
Have a good one.
Thank you.